Welcome to the Radian Partners videocast series. When we first began recording this series, it was really just an opportunity for us to chat with friends working on some fascinating projects. But over time, it has really evolved into a forum in which we discuss technology trends with some of the world's leading executives, investors, and thought leaders. Today's discussion will really be focused on the domain of health and human services. And for those that don't know, HHS is an enormous area of focus for both federal and state governments. And just a factoid that just sort of totally blew me away and really puts into perspective how important functionally this agency is. The HHS department at a federal level expects to spend $94.5 billion in discretionary spending and a whopping $1.3 trillion in mandatory spending. So this is incredibly important work. It has a huge impact on our country, on our society. And for that reason, we've really tried to incorporate into this discussion some of the leading perspectives in the HHS space. And we're very thankful to have a very esteemed group. So with that being said, I'd like to introduce our panelists for today's discussion. First, I'd like to introduce Kevin Jones, who is the Chief Information Officer for the Department of Child Services at the state of Indiana. Kevin was also recently awarded the Technology Executive of the Year by Indiana Business Journal, and he was also awarded Tech Champion of the Year by the National Association for State CIOs. Kevin, we're excited to have you here. Welcome.
Thank you very much. I appreciate the opportunity to share.
Absolutely. We're also very honored to be joined by Jose Arrieta. Jose is the former Chief Information Officer of the Federal Department of Health and Human Services. And Jose is very well known throughout the HHS ecosystem for the implementation of some very innovative emerging technologies, including HHS Protect, which is the largest public health surveillance program created during the pandemic, and also the largest of its kind in history. So we're very happy to have you as part of the discussion, Jose. Welcome.
Well, thank you. Glad to be on.
Of course. And finally, we have my dear friend and partner, Thiag Loganathan, who is a serial entrepreneur. Anyone who knows Thiag knows that he's working on a variety of different things. He's also a co-founder at Cardinality, which is a DC-based software company dedicated to driving digital transformation in the health and human services domain. So we're excited to have you as part of the discussion as well, Thiag, and hopefully we won't get into to football during this discussion. Otherwise, I know Kevin and Jose will give you a mouthful.
Thank you. Pleasure to be part of this esteemed company.
All right, excellent. Well, gentlemen, I'm looking forward to digging right in here. So the first perspective that I want to get from each one of you is really about change, and the change that has been taking place in the HHS domain, both at a federal and state level. Can you guys talk a little bit about what kinds of changes these are, and which ones have had the greatest impact operationally for the agency? Maybe Jose, if you would like to start.
Yeah, sure. So I think it's a great question. I think when you look at the ecosystem, the pandemic has proven a couple of things. I think first and foremost, we know that healthcare is highly fragmented across the United States. However, that fragmentation has become less and less as we've started to drive a response to the pandemic itself. I think the second change that's really kind of fascinating, and I got to watch it unfold firsthand, within HHS Protect, we had 5 billion data elements connected with every hospital and every nursing home, all the states, all 6 territories. What we started to see is that fragmentation led to lack of visibility and transparency within the states themselves. So I think there had been a robust debate for a number of years about investment in public health at the state level. What the pandemic has done is shown that, in fact, that argument for more investment at the state level in public health was, in fact, it's something that was needed. And I think it's shined a light on it to drive that investment. I think the last thing for me personally that's quite fascinating is that I think now is the time for healthcare to move to be a consumer-driven market. We've tried to move EMR, electronic health care records, directly to an individual for a number of years. But it's going to happen now, and it has to happen. And the reason is because Yankee Stadium or the Seattle Seahawks Stadium, they're not going to let you in to the park unless you can digitally show that you've taken a COVID-19 test and that maybe even that you've gotten the COVID-19 vaccine. In order to do that, and you're going to need to invest in creating digital identifier for individuals across this country so that they can control and keep that record on their person. So I think those are the three changes that jump out at me the most. I think the last thing that, and Kevin has actually kind of broken some of this glass, so it doesn't exist everywhere, but technology in the health space has always been something that was used when needed. When I think about our response, we were using supervised machine learning capabilities to actually identify hotspot outbreaks across the United States and take the limited tests we have, about 30 million a month, and move them to regions where outbreaks were going to occur in the hopes that increased testing would change human behavior, that they wouldn't go to the beach, that they wouldn't go to restaurants and bars. This was, in the April, May, June, July timeframe. That had never been done at that scale before. An enterprise capability running and creating visibility across the entirety of the United States in real time. So I think that the swell of change to accept technology and use technology to drive better health outcomes, it's actually occurring right before our eyes. And maybe in many cases, the hand was forced because of the pandemic itself. And I feel horrible for all the folks that have suffered during this pandemic. But I hope that the pandemic itself has better prepared us to deal with these type of issues in the future, because it took these challenges, it took the weaknesses of the system, it took the fragmentation, and it put it first and foremost in front of state, local, and federal public health leaders, and forced those issues to be addressed. And where those issues weren't addressed, you see the gaps on the nightly news. As it relates to the death total and the case total and the amount of spread that you're seeing across the nation.
Absolutely. Jose, you mentioned something that it just gets me so excited about this space in particular. I'm not sure if there's another ecosystem in which the application of emerging technologies can deliver not only a substantial business impact, but also a societal impact. These technologies that we're talking about, whether it's AI and machine learning or blockchain, applied in other areas, they might save some money, they might make a business process more efficient. But in this case, for HHS, the application of these technologies can result in large scale impact that affects our communities, that affects individuals. And this sort of thing really, I think, is inspirational. It says a lot about the importance of the work of the HHS department.
I want to give you one example, because you're absolutely right. And so I want you to imagine this. COVID-19 as an illness, as a disease, it mutates every 2 weeks. Can you imagine if you could simulate what that mutation would be in real time? Well, what would you need to do that? Well, you'd need the genomic structure of pathogens at the zip code level across the United States. Does that exist? It exists. We can get Duncan McConnell from CDC on this show, and he can talk to you a little bit about CDC's work in that space. Well, what else would you need? Well, you'd need some environmental insight at a zip code level across the United States, because different temperatures and different behaviors of people in different zip codes would affect the disease itself, right? Well, we have that. It exists in the 6 billion data elements in HHS Protect. Yeah, but you could never run alongside and mutate at the speed of a disease, could you? I mean, you'd really need something like a quantum-inspired capability to do computational analysis at scale in real time. Well, we have that. We have the ability through something called a digital annealer that you can actually do that. And the computational work that would take a supercomputer 3 days, you can now do in 27 minutes. So you have the ability to simulate how the disease is going to mutate in real time. Think about how that changes the development of therapeutics and the development of vaccines going forward. And the role at a federal level of HHS, is to fundamentally ensure that the system allows for that innovation to occur. And that, my friend, is going to be very powerful for the future of public health. I want to share one more thing, because if I don't share it now, I'll forget it. You also have a giant blinking light in the world right now for investors. And here's the thing. Do investors invest where there's data or not? Investors invest where they can quantify risk. How do you quantify risk? You quantify risk with data. Where's the number one place where you have data insights on COVID-19 around the world? It's the United States. And it may not always be positive, and it may bring a lot of questions to the table in terms of should we have done this or should we have done that? But it exists. So the United States right now, if you're an investor in healthcare, it is the number one destination for healthcare investment in the world, because if, as an investor, you can take the data that's publicly available and you can quantify risk when you make an investment. The other thing about the US market that's very fascinating is there's a number of people in the United States that still don't want to get a vaccine. They're uncomfortable with it. And maybe it's because of the propaganda efforts that have been waged against the United States for the last number of years to tell people that vaccines aren't that great for you. Maybe it's just personal preference, but what does that mean? It means people will continually get sick with these illnesses. So they're going to continually need therapeutics. They're going to continually need to see doctors. They're going to continually and slowly pivot to accept and want the vaccine. This is an opportunity of a lifetime to set the direction for the world for the next 100 years on how health services will be delivered to a population, and it's happening right here around us. And if you're not excited about that, then you better go join the banking industry.
Love that. Well, I, for one, am excited about it, and I think all of our panelists are too. So let's transition to Kevin's perspective. Kevin, Jose referenced a couple of things that you've done in the past as well, but please share your perspective on the kinds of changes that are occurring in the HHS space, and which ones, in your perspective, will have the greatest impact.
Yeah, I think one of the things I like to keep it kind of broad, because I have a theme that I keep even for myself, which is be water. So whatever the solution or whatever the opportunity or wherever the need goes, I go, so that I can actually capitalize and bring innovation to that situation. And I think one of the things I discovered, just to put some context so we can really kind of quantify for the audience what we're talking about. You mentioned $1 trillion or over 1 trillion that will be discretionary spending. That spending goes to the states. So that money is money that gets to fund our situations and our solutions. Prior to me coming over to Child Services, I was a CTO for the Indiana Department of Family Social Services, which manages Medicaid and Medicaid eligibility. And that particular group was over $10 billion from the feds that actually get spent. Just to put more in context, over the course of the 5 years, I will be responsible for developing and implementing over $1 billion worth of new system development, not maintenance and operations, but new systems development just for one of the 50 states and the territories also including that, so Guam and Puerto Rico. So in one instance, 90% of the funding for that system comes from the federal dollars you mentioned. 50% of my child support system, or 66% of it, comes from the federal dollars you mentioned. 50% of the child welfare system comes from the federal dollars that you mentioned. And then multiply that by 50 states and territories. That's where you get your split. That's where you get your money being spent, and that's where that money gets implemented into the systems. One of the things that I really focused on was the issue of how we implement systems. And we find that, and we'll talk about that later, but we find that systems are being implemented in a way that's not conducive to the new model for IT itself, as well as the system implementation and managing and owning the cost of owning of those systems. And one of the focuses I've looked at is really paying attention to building an ecosystem that can be leveraged not just by your HHS organizations, but your other state entities, where states will start to leverage that. And we've seen that actually applied in my situation in my state. Looking at technologies that are water-based technologies that allow you to implement blockchain, like you mentioned, allow you to implement AI, and that AI is going to take a person or person identification and identification protection. Those are technologies, those are platforms that are going to allow the organizations to make the transition from owning infrastructure that's antiquated to moving towards owning cloud-based ownership of the IP, not the architecture. And I think those are the things that we should be looking at, having a flexible platform, having flexible technology that enables and empowers not just to implement a new system that manages the continuity of business, but implementing systems that allow for continuous improvement and infrastructure that will continue to grow. And it builds a model for the individuals who are implementing IT and owning that IT and building partnerships with states, building partnerships with the HHS and GovTech, and putting us in a situation where the federal government can have more of a, not necessarily control, but influence. Because right now what happens, Mohammad, is that you see the feds will just give us money, check our plan, and then they come back later to make sure you did that plan. But I think what I'm looking for and what I'm looking at is the potential for implementing not just a Medicaid system, a child support system, a child welfare system, but building ecosystems that allow us to normalize that, share that data similar to what Jose mentioned, create an identity of our constituents, not just for vaccine, which we're responsible. We just recently purchased vaccine management, not just vaccine, but the need of the constituent, the need of the citizen, regardless of whether it's a vaccine or whether they need Medicaid or whether they need SNAP or TANF needs or services, child welfare, child support services, building that ecosystem that can transcend just your agency and build a layer at your state level that enables a citizen to have a relationship directly with the state based on their needs and directly with us based on our needs and our ability to help better understand how our people move, work from a perspective of we want to serve you, not control you. So that's what I'm looking at. And that's what I'm really excited about. The opportunity to transform GovTech, starting with HHS as a whole, and create a service layer that doesn't exist today.
Fascinating insights, Kevin, and I especially appreciate your metaphor of water-based technologies. You've got to coin that term. You got to trademark it or something. It's a wonderful metaphor. Love it. All right, and so Thiag, let's get your perspective as well. In your view, what are the biggest changes happening in the HHS space with the exposure that you have directly with a variety of different states with your work at Cardinality from your perspective?
I'm going to just build on top of what Jose and Kevin mentioned. Yeah, it'll come down to a couple of themes. The system, the governing system is established. I mean, the federated system. You have the feds, you have the states, you have the county. Right? It was all established for the pre-tech days, wherein you need a local governing agency to take care of the needs of the local constituents. But now with technology and connectedness, you don't have the same kind of challenges. So how do you deliver? Another aspect that Kevin mentioned, I'm going to kind of pick on that aspect. That is the siloed delivery of services, right? Jose also mentioned about the fragmentation. Those are all of the past. You don't need that anymore. Everything is very transactional. I'm also going to borrow another good friend and a partner. I'll give him credit for this. Kamal Berwani, CEO of GCOM. He uses the words outcomes produces incomes, right? So meaning the systems are all wired to do transactions, to services. If you stitch it all together, if you have to take the holistic needs, not just of a constituent of a family, right? And you take the family under distress and all the services available, whether it's health or financial or wellness distress, the right packaging of services for a positive outcome for the family will help that family become self-sustained faster. Really, that's the goal, right? So things are coming together in a manner that the fragmentation, the silos are getting broken down. Kevin mentioned about this common data ecosystem that's getting shared across agencies, whether it's not just health, you include labor, meaning unemployment, and include other agencies in government. So there is this opportunity for outcome-oriented services. You have needs, you have spend. Instead of spend, if you look at it as an investment, I mean, that's really what this budget is for. It is for, Jose mentioned about investing into public health. How do you prevent more instead of respond? How do you invest more instead of spend? How do you look at outcomes? Because healthy constituents with good wellness and skills, they generate more taxable income, and then it goes into a nice positive cycle of outcomes producing incomes. So I believe, I mean, pandemic is just accelerating that breaking down of silos. It's accelerating how can you use data for prioritization, delivery of services to match the needs. And I mean, if you're a technologist, while again, it's sad what's happening. I mean, the impact of what is possible leveraging data, AI, and modern technology to meet the needs of constituents as a family. And also the goal, I mean, the agencies want the goal. The goal is good outcomes, right? And bridging that, and cannot be more excited about that.
Absolutely. That outcomes orientation is, it has truly proliferated the ecosystem, whether you're talking about technology companies and the business model that they're focused on, or whether you're talking about, CIOs like our guests here, who are trying to reorient themselves when they think about technology solutions. Well, gentlemen, thank you for your insights on that first theme. Let's transition to this second theme, and the second theme perhaps takes some of the success stories that you guys have enumerated, and it analyzes them in parallel to some of the challenges. Not all large-scale technology implementations, by the HHS agencies, whether at a federal or state level, have necessarily gone well. And it speaks to the complexity of the agency. It speaks to the complexity of the constituents that it serves, et cetera. And so I'm wondering, from a business ROI standpoint, what needs to be done to really capture the ROI for a lot of these different technology investments? And how does the modern day technology executive think about the time horizon? When a CIO makes a major decision to implement a new technology, is the ROI time horizon for that, measured in, in months and quarters and years and decades? How do you truly capture that business ROI perspective from these technologies? So we'd love to get your perspective on that. I guess let's go in the same order. Jose, you want to share your perspective?
Sure. Yeah. So I think the first question is I'll share some lessons learned. And having recently resigned from HHS on August 29th, I've had an opportunity to reflect. I think the first thing is the way you implement. We used a microservices architecture and a blockchain-based capability to pull together about 20 terabytes of data related to the historical spend through contracts at HHS over a period of 10 years. And in reflection, what I learned is we built the microservices first. We did human-centered design to build a series of microservices that were a representation of a business process we wanted to automate. But I think that was the wrong starting point. And I was actually on the phone with somebody today from another large federal agency. And I said, if I had to do it again, the first thing I would do is use backup cloud storage tools to actually move legacy data into a commercial cloud environment. I would immediately go back to the program office that was my partner and deliver that savings to them. And then I would use this environment as kind of an innovation environment where you could test different COT technologies and any microservices that you built. So I think the order with which you execute is really important. I think the second thing that I've learned in my time reflecting, my hair's gotten darker, by the way, since I left. It was really gray before, and I've always had the receding hairline, but it was even further back. It's fighting back, kind of like the Seahawks tried to fight back in the playoff game the other day, but they failed. It's fighting back now. So I think the second thing that I learned is that these technologies flatten organizations. And so a lot of the federal agencies, and I don't know how it is at the state level, but they're top down in terms of the way they communicate. And I think really using civic engagement tools to directly engage at the working level of these agencies is a great way to ensure that the message reaches the workforce that's going to be impacted most by the modernization effort that you're implementing. Okay. Now, from our perspective, if you do those two things, I think you can measure return on investment in a number of ways. I think you want to always measure employee satisfaction with the set of capabilities that you're putting in place. In our instance, we were connecting with industry too. And so we wanted to measure industry satisfaction as it related to speed, because that was what we were trying to drive for them. But I think as it relates to return on investment from a savings perspective, we really bucketed it into two categories. I want to be able to get rid of some of my legacy costs, right? But then I wanted to be able to rapidly understand and drive savings associated with, in this instance, contract expenditures that were occurring throughout our ecosystem. And I oversaw about 26 billion in contract spending a year and about 800 billion in grants. And so what we did to measure return on investment is we focused in on using that insight and data to understand the difference in prices paid for certain licenses. And we just used that insight to go and negotiate discounts on pricing. And so I would say it took us about a year, but we were able to generate our first $50 million in savings in January of 2020. And then right as I left, we awarded another contract where we were able to generate 90% cost reduction as it related to a set of technology capabilities that were licenses that we had in place. And so we literally generated $100 million in savings off of about a $12 million investment. And then you have to put a measure on how you're improving the speed with which people are able to do their work, and then how happy they are with the systems. I think that's how you measure it. When you get into delivering health outcomes, one of the things that I think is extremely important, and you're seeing it play out right now, you have to have, look, this is the #1 consumer market on the face of the earth, okay? If you don't have a demand signal, if you're just going to ship a box of iPads on a pallet to Jacksonville, Florida, and you don't know like how many people live there and how many people are ready for an upgrade, you're going to fail. You're going to have a bunch of iPads go to a place and people aren't going to purchase them, right? So the way that you measure return on investment is, in the case of vaccines, how many vaccines actually get to people's arms? And that equates to saving lives. And that's the measure. And what I think at the federal level, what we have to understand is that logistics and distribution are important, but we distribute for a consumer. Health doesn't end at a gas station where people show up and get gas when they need it. It ends when you convince somebody to go and sit down in a doctor's office and get a vaccine, which quite frankly could save their lives and could save the lives of the people that they interact with. Right. And I think that is how you measure the actual success of the investment. And if you go all the way to the watering hole to drink water, but like you forget a pail, so you can't carry any back for the rest of your family, then you didn't achieve your objective. Right. And so I think as you get into the healthcare space, it's really how many people are we serving? And then by serving those people, by achieving herd immunity, by vaccinating 75% of the population, how many lives did we save, right? And then, and I want to touch on this, and Kevin will be able to provide way more insight into this than I ever could. And Kevin, I respect all the stuff you've been doing and probably all the sleepless nights that you've had. I've had a number of them myself. But at the state level, if we don't invest in the ability to connect with the people that live within the states, if we don't invest in the ability to have visibility into what's happening on the ground at the county level, if we don't make that investment, then the loss is the loss of lives, right? And that's an investment that the United States has to make as a whole in the 50 states within the union. And I think you measure return on investment. And I gave you one example in health, but you measure it on the basis of lives saved, the amount of transparency you have, because what does transparency create? It creates a deterministic ability to understand cost. And in this case, cost is losing your life. Imagine if I told you that you could go and get a cloud capability, a commercial cloud capability, and I could guarantee you a fixed price in delivering you the service. Would you do business with me? Or would you continue to do business with the other cloud providers where you don't really know what the price is going to be because you don't know how much you're going to use it? That should be the measure for health and delivering health outcomes to people. Be deterministic in how many lives you're going to save because you have visibility and transparency into that ecosystem. And that's what you're investing in, right? And one of the things I love about the work that Kevin does and that Thiag does with underprivileged children, adolescent minors across the United States, is they're directly touching an individual. And by touching that individual and creating that comfortable interaction that's built around the health outcomes that the state wants to drive, they're saving lives. Just want to kind of point out one other example of this for folks that are maybe not following the couple, 2, 3 that I've given so far. One of the things we built at HHS was the ability to look at, we haven't, I don't know why, but it wasn't kind of made public, but the ability to look at the economic impact of the pandemic by zip code across the United States. And what we were doing is taking publicly available hospital balance sheets, healthcare worker unemployment, and maybe like 50 other variables. And we were being predictive of the impact of the pandemic at a zip code level, at an industry level within those zip codes across the entirety of the United States. And what we could do is we could see where food banks were going to pop up, because you don't lose access to your cell phone the second you lose your job. It takes a few months for them to catch up with you. They don't shut off your cable or your heat a week after you lose your job. It takes a minute to catch up with you. But 3 days after you lose your job, if you don't have something to eat, you're going to go to a food bank. And what does a food bank do? Probably doesn't provide the most nutritious food. And I know Kevin knows this because the Indiana guys know this better than anybody. What does a food bank do? Maybe not the most nutritious food. What does that lead to? Diabetes. What does that lead to? Amputations. What is the long-term health impact from a cost perspective and a life perspective when those food banks sprout up? You can actually calculate that. And if you have visibility, you can hopefully eliminate some of the loss of life and also some of the costs associated with people becoming diabetic and not having private insurance. People having to have a body part amputated and not having private insurance, where they become a cost to the state, right? And that's why healthcare is important.
Thanks for sharing that perspective. Kevin, obviously Jose referenced a variety of experiences that you've had. So maybe share a couple of, points that you have about business ROI, in particular in the context of, measuring it as a lot of these emerging technologies are implemented.
Yeah. So for me, that was a primary thing for me and reason for me to be asked to come over to manage these new systems that were required for us. The primary things I've seen from states and implementing systems is the need or the perception in our efforts of prevention of loss of life and prevention of loss of property and risk management is the need for custom built systems versus some of the emerging technologies that now are capable of being replacements for their legacy systems over the custom built systems. One of the things we were able to do is to build an architecture that we leverage Cardinality and its blockchain, its artificial intelligence with Redbird as the foundation for replacing our financials, and an IBM-Z, which historically has been the roadblock for all 50 states in replacing their child support systems, as well as child welfare systems, eligibility systems, Medicaid systems. We were able to take that and reduce the opportunity cost of both implementing the system and the total cost of ownership. That opportunity cost enabled us to go from owning custom built systems that take 7 years to implement, and most times double what your original estimate is, down to a 2-year implementation. And we went from our original estimate of $250 million just for one of our systems down to 40 million. 150 million for another system, down to 24 million. And a total cost of ownership that will put over $1 billion back into our state to reinvest in other areas. And platforms like this put us in a situation where we not only no longer own the reduction and the depreciation of a custom IP that has only value to you, that is implemented the day you start using it, but 7 years old because it took 7 years to deliver. We're able to take advantage of a system that is opportunity to improve your process. And when you're spending over $1 billion in operations, and you can automate that, you can give the best outcomes to children, you can ensure that more of your effort is being delivered in the output of the outcome for the individual. These solutions give you that, and it reduces your cost of ownership. It reduces the infrastructure costs, and it ensures that when you put in a continuous improvement model for your operational process and people, your technology is built on continuously improved technology that the vendor, that the owners, that the cloud providers are always reinvesting billions of dollars back into ensuring those platforms are up to date. And I think that is one of the biggest things and part of my legacy to leave. And over 20 states have adopted what we've done and looking at it as their model to be able to show them the path of not needing to invest in a custom IP with 5 to 10 years worth of development, invest in cloud platforms that are always improving so that you don't own depreciation. You invest in that R&D and continued improvement so that you're always using the most relevant emerging technology and have the benefits of that and deliver that to your citizens.
Thank you, Kevin, for sharing those insights. And for this question, we'll end with Thiag, your perspective on business ROI.
Just to pick up from where Kevin left, right? Specific examples. Some of the programs that we're involved in Maryland, they were able to go live in 20 months when they were modernizing their child, juvenile, adult systems compared to 5+ years historically, and then 5 times lower implementation costs, right? The value of that is just significant. It coincided with the fact that during pandemic, the case workers could not go to places. So now the modern technology absolutely came to help, right? People being able to do their job, being remote, leveraging digital technologies, having data at their hand. That is the success. That is the possibility of doing things faster, leveraging tech and platforms that are out there. And then, another aspect I just want to share is, so one of the things I heard just as we were publishing in the content around this is that a person reached out talking about how when she, adopted a child, that child had gone through 4 or 5 houses before it got to her place, right? While we want children who don't have parents to be adopted, that is, and everyone wants it. The challenge of that not happening more is not because there's not enough parents who are able to take it. It's the connection of it. It's how can we make it faster? How can we get the child in with the right parent matched? So that we got to be focusing on that. And this kind of a technology allows for us to be able to focus on improving, again, goes back to improving outcomes, right? And one of the key things that, at least in my personal experience, what I've found is it starts with a leader. I mean, I have my own, I've coined a word for it, human unicorns, right? People like Jose and Kevin, these guys are super capable of, rallying up champions, advocates, convincing. The challenge is basically when you try to get things done in the government, it's not easy. You have multiple stakeholders, right? You have the policy leaders at the state level, you have policy leaders at the county level, they all want to do different things. Then you have the technology leader who know what's possible, what's not possible. Then you have an integrator you hire, and then you have software platforms. And everyone's got different motivations. There's conflicting priorities. How do you bring them all together? How do you get things done in 20 months compared to 5 years? How do you get things done in 2 months that's never been done before? I mean, it takes people like Jose and Kevin, and there are plenty of them out there. And maybe I shouldn't say plenty. There's enough of them out there. It's about all of those things coming together to deliver success, to deliver ROI outcomes for HHS and government programs.
Well, I've got to say that the perspective that you all have shared about business ROI is encouraging, because the perception, of course, from the external world is that, a lot of this government spending, even, the government spending that's going into technology is inefficient. The bureaucratic processes are limiting the potential of the technology. But when practitioners like all of you, both on the inside and the outside, are orchestrating business ROI measurement so intentionally and deliberately throughout your programs at the state and federal level, I think it ensures that the ROI will be there. So thanks for sharing that perspective. Very great to hear. Gentlemen, I think we have one final question, and then we'll wrap up. So we'll consider this our rapid fire question, and then so please feel free to answer the question and then include some of your concluding thoughts as part of this conversation. So the question is, this is a magic 8-ball question. What does HHS look like 10, 15, 20 years down the road? Who are the people? What are the tools? What is the magnitude of the impact that the agencies at the federal and state level will be driving in 10, 15, 20 plus years? Jose, please go ahead.
Yeah, so I don't actually believe that people can predict the future 15 to 20 years out. And so, but what I would say is that I think that what the passion for healthcare and delivery of healthcare will continue. I think that the focus of a large scale agency like HHS will pivot to and become a validation function, and that the infrastructure of an agency like the Department of Health and Human Services outside of the business systems will be modernized to use distributed technologies to connect consumers directly to healthcare providers or different entities within the ecosystem in a frictionless manner to ensure security. I think that one of the things that the healthcare sector, if it hasn't woken up to, it will, is that creating a modern health internet where transactions can occur, where health data can be protected, where there's a focus on cybersecurity, a focus on decentralized identity, a focus on bringing the consumer directly in contact with the provider of services, and eliminating a lot of those business processes and infrastructures that were put in place when these technologies didn't exist. I think you'll start to see the agencies that do health and human services evolve in that manner. Focus on security, focus on connectivity, focus on internet, focus on digital identity that empowers an individual. I don't know where it will be in 15 or 20 years, but I think those will become the fundamentals of a successful health and human services, whether it's at the state level or the federal level or at a national level, that empowers people and really focuses on putting the spotlight on protecting the human condition, and which is very much an effort focused on doing something for an individual. So I think you've already seen that, but I think the technology that exists now is going to allow that partnership between service provider and individual to become even closer. And I just hope that I can be a part of developing solutions that actually create that connectivity to help that adopted child, find a home and feel the love of being part of a family sooner and as rapidly as possible, versus working through a more elongated process, which definitely probably existed 20 years ago and has become much shorter recently, and I think will continue to become shorter as that evolution continues.
Wonderful. Thank you, Jose. Kevin, your perspective on sort of the future of HHS?
Yeah, so I'll go based on trends and what is being required of us now, and where those you can see paths where they actually do evolve, and they do align with what Jose mentioned earlier. But I think it really starts with that omni-channel API layer. Really have an omni-channel API that allows any way to consume and any way to deliver that data specific to whomever, whether it's a need from a sister agency, another state, or another entity that actually has to consume your information and make business decisions based on your information. The cloud platform providers that enable case management, enable that cloud-based case management that is powered by artificial intelligence, powered by blockchain, and then those for lack of a better term, those ERP cloud-based solutions, which there aren't any that I know of other than Cardinality right now, that are cloud-based platforms that enable fiscal transactions, enable and empower you to be able to make payments and claims processing in the cloud, and getting away from states owning that infrastructure. And then also looking at the identity access management space, where you're starting to see all of the things that you need to identify and protect a human individual. And even going to the point where I can discover who that person is and know that I'm verifying that this bio dad or bio mom is who they say they are, and they are what they say they are. So those types of platforms are going to be critical in moving towards where we're being required to be at, which is being able to understand our constituents, being able to provide our constituents with what they need, consuming their input, making sure that we have sound artificial intelligence that allows us to stay in compliance with what our federal compliance requirements are, and making sure that in compliance, we're delivering the required services, delivering the required outcomes to those individuals, and then taking that and then matching them with the best case scenario. Being able to say that this provider, even though it is a service, but this provider is best fit to provide this person with those needs. So those are all technologies that we're implementing, technologies that are emerging and will be capable of providing the outcomes and the services that we're looking at and what we're required to do over the next 5 to 10 years for sure. And I think those things are what I'm looking at and what I like to bring in, and absolutely what I would consider a water-based technology.
Love it, Kevin. And finally, Thiag, your perspective, future of HHS?
And a few others in that category, right? Big tech can understand people, deliver services that they didn't even know they wanted, and actually make them buy stuff they don't want, right? So that capability, I believe, in the nonprofits and government, and there is a community of people who want to do things for the good, right? I believe they will acquire that capability. That they will make that capability available for social impact, health impact. So connectivity happens faster, right? Outcomes are achieved, and money spent well. It's more of an investment, helping families and people get healthier, holistically. I mean, just wellness aspect of it. I believe. You can probably tell I'm a hopeful guy. I believe in that possibility of big tech being made available to government and nonprofits and health leaders.
Love it. Thank you, Thiag. This has been an absolutely exceptional discussion. I'm coming away with a lot of excitement and hope about what's next in the HHS space. You guys have really enforced a curiosity that I had about the implementation of innovative technologies in the HHS domain, the pursuit of not just economic impact, but also social impact, and of course, the financial discipline for this enormous investment in the technology to actually be measured with the discipline around ROI. It's really exciting, and I'm very thankful to all of you, Kevin, Thiag, and Jose for joining us as part of this discussion, and hopefully we'll have another one very soon. So thanks again.
Thank you.